webinar on crisis management during the coronavirus pandemic. We want to focus on some lessons learned, and we want to hopefully offer you a vivid conversation on the things that have happened so far during the pandemic and what are the implications behind them. We have an impressive array of panelists and contributors that I would like to recognize. When the moment comes, I will introduce each one of them properly. But on behalf of UNITAR, I must begin by expressing our appreciation to all of you. Without your concurrence and support, we wouldn't be able to have this conversation. The objective today, as in any webinar that we have, is simply to bring to all of you listening to us around the world some ideas, opinions, suggestions, comments, best practices, recommendations from leading practitioners. And as you will see when the moment comes to introduce our panelists, indeed, we have the right people for this conversation today, quite an impressive array, as I say. I should also recognize, it is my great privilege to do so, two partners of UNITAR that has been with us for several years now. Number one, Kansas State University in the United States of America, represented by Dr. True and by Dr. Bingbing Jiang. Before the proper presentation, as I say, I simply wanted to say thank you for being a trusted partner of the United Nations, and particularly of UNITAR. KSU, Kansas State University, also hosts a CFAL center, CFAL training center in Atlanta at the campus of the university. We also have the support of the University of Suffolk. Professor Mike Sachs, our good friend, is an emeritus professor at the University of Suffolk and quite an impressive academician. I don't mean to embarrass you, my dear Mike, but it's quite an honor to have a person of your stature, intellectual and personal, with us here today. So we are looking forward to that. And again, thank you for the support of Social Precisions University as the University of Suffolk. And also related to Dr. Sachs and myself, if I can include my name in the comment in a humble manner, we have the Institute for Responsible Leadership in London as a not-for-profit organization that has achieved an impressive accolade so far in being perhaps one of the few organizations in Europe that is focused on that particular niche of leadership. Leadership, as we all understand, and particularly when we talk about crisis management, makes a big difference. And if something has been challenged during the coronavirus pandemic, is leadership. We have seen the difference in outcome when leadership is there, when the right leadership is there, when responsible leadership is there. And in that sense, again, to Professor Sachs and to Dr. Whitaker, Seth Whitaker, Julie, our good friend as well, congratulations for what you do to build capacity and to create this space to learn more about responsible leadership. We will start with some presentations, but allow me also to welcome Dr. Miwako Hosoda. Dr. Hosoda is the Vice President of Seisa University in Japan, and it's quite an honor for us to have you here. You have beautiful communication materials, and I am particularly impressed. So to you, Miwako, welcome. And again, thank you for the time you will give us. Thank you.
Very much.
Our pleasure. Very good. Time is short, so let's get down to it. Allow me to share this initial presentation, as I say, to put things in context. As of yesterday, we have 216 countries and territories infected by the coronavirus. And some of you could say, let's go back to the numbers, because there are only 194 countries in the world, formally. Yes, but there are many sovereign territories also around the world, and we have included all of them. There is no exception, unfortunately, as of today, on this pandemic impact. And it's very sad to see that the whole world is actually under coronavirus stress. Next, please. You will see in this presentation that we have indeed several statistics that we use. I should mention that the authorized statistics or dashboard, for lack of a better name, that we use in the United Nations system and in the governments is, of course, the one from WHO, the World Health Organization, also based here in Geneva. The WHO has allowed us to see the difference since we started counting, since we started to be aware. You can see to the left on 15 March, we had 169 cases. As of 7 September, we have more than 27 million cases. But the sad number indeed is the column next to those numbers. We had 6,500 deaths by mid-March, which was already shocking. And we are reaching 900,000 deaths as of now. You can see the countries that have suffered the most. But let me go forward because time is short. In the next slide, you're going to see the exponential growth of the coronavirus pandemic. Very sad indeed. We haven't seen in the past or in recent history something like this. We have seen high incidence epidemics. We have seen short-lived pandemics, but we haven't seen a health crisis like this with that level of exponential growth. And to the right, you have the VARs per day. So every single VAR in red is the numbers on the day before. As of 7 September, we had 266,000 cases, new cases reported on that date. Next, please. In this slide, again, to put things in perspective, allow me to say that COVID is not the more deadly of viruses, but it is to be taken into account. It has the rate of reproduction of 1.5 or 2 times the flu. 17% on average until last month of cases require severe intervention, including oxygen, but not necessarily intubation or going to an ICU, an intensive care unit. 5% of those cases indeed require that and become critical. And the mortality in the end is approximately 4 points, somewhere between 4 and 5%. And you see to the right, which I'm not going to read, you can simply see a comparison between coronavirus and other viruses in terms of the reproduction capabilities and the case fatality. Next, please. Let me go to the numbers and to the economy. The numbers in terms of the incidence and prevalence you just saw, the pandemic continues to grow. But when we go to the economic numbers, this is dismal indeed. I had the privilege of being an alternate governor to the International Monetary Fund and the World Bank, and I still remain in contact with some colleagues there who believe that what you are going to hear is still optimistic, even though it's shocking. So let me go to the authorized version, which is what Dr. Geeta Gopinath, the chief economist of the International Monetary Fund, shared as outlook already 3 months ago, and the numbers have been slightly reviewed. The IMF is projected that there will be a decrease in real GDP growth of between 3.5 and 4%. And if you compare those numbers with what happened in the global financial crisis 1 decade ago in 2009, the total incidence of what we remember, which was indeed very preoccupied but short-lived, thank God, was 0.1 decrease, not 1%, but 0.1%. So no comparison whatsoever. Dr. Gopinath said correctly that the great lockdown, as we are calling this time in our lives, will result in the worst recession since the Great Depression almost a century ago. Next. To remain optimistic, we have to, of course, assume that the world economy will bounce back. Hopefully, as soon as a vaccine is discovered, tested, and then distributed and administered to the population, that takes a long time. Our colleagues, experts here in the ecosystem of public health in Geneva, assume scenarios that go to the second quarter or the third quarter of 2021. And that's a long time with an economy that has already been in recession, if you use the normal terminology to categorize something as a recession. Here, we are basically saying that the recovery as of last month, if you project the numbers, should amount to $9 trillion that have been lost, and that we will need to grow back 5.8% next year in 2021. We do hope that that is the case. Now, from public health to macroeconomics, now to public policy. Go to the next slide, Julia, and thank you for your help. I will make it very simple. At the United Nations, we have been calling, our Secretary General, Mr. Guterres, has been calling for building back better. My Assistant Secretary General, Mr. Nikhil Seth, one of the fathers of the Sustainable Development Goals, SDGs as we call them, really pushes us, our organization UNITAR, to build the capacity needed to do exactly that, to build resilience and to build back better. And here in these letters with R, in these words that start with the letter R, you see that the path to the next normal, in one way to postulate, there are many, will require resolve. We have seen resolve so far. Resilience, we need to invest in resilience. I love the definition of resilience that uses the case of a tree and the wind. When we ask what is really resilience, and the typical basic answer says, is what happened to the tree, which is bent by the wind, and that after the wind passes, goes back to normal. That's a beautiful definition. We hope that after this pandemic passes, we go back to normal, that the governments can do that, that civil society, the private sector, industry, and the like can do that. So that return, we were hoping will start now, after the European summer, at least in Europe, is not happening. Many people assume that this coronavirus started in earnest in the global north, in Europe and North America, perhaps North Asia, that it will be a matter of 2 months or 3. It's been 7 or 8, depending on how you count, and it's still counting. So this will require reimagination, because the back to normal will be a new normal. It's not going to be as we remember in the past. And that calls for reform. The United Nations has been persuading governments to use this opportunity, this challenge, which is also an opportunity, to improve regulatory frameworks, to facilitate competitiveness, to protect the environment, and especially to facilitate the creation or preservation of jobs. Global unemployment is growing rapidly, and is preoccupating, because from a public health crisis, we are in indeed a macroeconomic crisis, and we will go to a social crisis. Next, please. There are several economic measures I'm not going to mention in detail, but our organization believes that at least 2.5 trillion are needed to, this is just this year, until December of this year, to address the crisis. Next, please. On social measures, you have seen what governments are doing, but it has mostly been trying to modify social behavior, social distancing, and the way we actually operate, restricting traveling and the like. But there is still a lot to do when it comes to the psychological effect of the crisis. We have not started talking in detail of what is happening with mental health, and that will require social measures as well. Next, please. So, just to introduce the topic, and I'm not necessarily an expert, we have experts here that I would be introducing very soon, but just allow me to say, to provide a basic definition, that crisis management involves activities needed to evaluate a potential crisis, make sound decisions during a crisis or during a stress or a challenge, and to learn, and that part is very important in this conversation, to learn from crisis experience in order to build resilience. Governments are very much in crisis management mode. Governments are very much developing a learning curve, which we celebrate and we welcome and we support. And governments are very much focusing on going back to normal. But we don't think that governments are focused on resilience, and that's what we want to discuss today. Because to build resilience, you need to start now. Resilience is not built after the fact only. The lessons learned are different when they are registered during the event, during the challenge. Then allow me also to say that crisis management should be seen as a management model developed for efficiently addressing an unusual situation, an unorthodox situation which emerges suddenly, which is what happened here, that disrupts routine functioning, which is what happened with this pandemic, which makes decision-making more challenging, which is what's happening with this pandemic, and that increases risk, stress, and conflict, which is indeed what we are witnessing. So, in order to implement effective crisis management strategies, public administrations, and particularly government officials, should be knowledgeable and skilled in crisis management. I am a former government official, and I can tell you, I know the things that I'm supposed to know on public policy, on issues of economic matters and financial matters in the public sector, but not necessarily when it comes to crisis management. I had to learn crisis management after the fact. And we believe it would be excellent that everyone working in government should actually be trained on crisis management. This requires to be committed to allocating resources in crisis preparedness, another very important word that we want to use in addition to management. Next, please, Julia, I have only two more, and I want to accelerate. We don't have the time here to discuss the differences between the public and private sector, but some of the panelists will cover them. I simply wanted to leave you with this very basic diagram that starts, number one, with preparedness, then the response to the crisis, then the stabilization of the crisis. We are trying to enact that part of this cycle when it comes to the coronavirus. Then the recovery will come, and then evaluation in order to build resilience again becomes very much necessary because it strengthens preparedness. This is just one of the academic portraits of a crisis management cycle. There are many, but we wanted to clearly, in introducing the topic in light of the coronavirus pandemic, see that there are several very distinct phases that we will need to address. And last but not least, Julia, a small commercial, if you can give me the next slide. I would like to invite you all. This will be launched at the end of this month. We still have to coordinate with Dr. True at Kansas State University how we will go about. He was very gracious to encourage us to build up this course several months back. We are about to finish, Dr. True, and it will be our privilege and pleasure that UNITAD will join forces again with Kansas State University to launch this crisis management for public officials e-learning course at the end of the month or beginning of October in coordination with you. But just to tell you and to invite you in advance, the course will be covering on what are the skills necessary to effectively manage a crisis and to continue operations in the public sector. You see there some description of the course background, the target audience, the course structure, and the learning objectives, of course. But you will, if you are participating in this webinar as a registered participant, you will receive an invitation. The first edition has 100 scholarships. Normally this costs money, but we are very happy to announce this today, something for people that have registered to this webinar that will have no cost. It will be free of charge, and it will have some digital badging that we will also need to discuss more with Dr. True. Very good. So this is my presentation. Time is running, and I had only 15 minutes, but I have used more, so I apologize. Let me now go to the panelists and have the pleasure of inviting the first one of them. Ms. Julie Search Whitaker, who is the coordinator and convener for the Institute for Responsible Leadership in London. As I mentioned at the beginning, it's a outstanding partner for UNITAR and for the United Nations, and a very knowledgeable person when it comes to leadership training. She has a vast experience of human resources on academia, has been a teacher and a professor, and it is my great pleasure to give her the floor. Julie, now we listen to you. Thank you.
Okay, thank you, Alex. And thank you very much for inviting me to contribute to this webinar. I think it's going to be a really, really interesting webinar, and I'm looking forward to listening to everybody's contribution. So Julie, if you'd like to just go on to the next slide, that would be great. Thank you. So my experience is, my background is extensive teaching in all age ranges, and by that I mean all age ranges, from 0 to, my oldest pupil was 76 in the community. Extensive management leader experience in a whole range of educational settings. I'm at the moment a school governor in a London primary school, which actually means I'm on the ground dealing with some of these issues as they come up, and I'm the coordinator and convener for the Institute of Responsible Leadership. Thank you. So I would like to follow on, next slide please, Julia. I'd like to follow on from what Alex was saying about crisis management, and really it's generally the process in which, you know, organizations deal with a threat to themselves or to their stakeholders that's disruptive and unexpected. In a school context, this would normally mean things, a response to shootings or stabbings or terrorist attacks, natural disasters, and I have had to be involved with some of those things in terms of being trained in crisis management. However, COVID-19 has forced crisis management in a completely different way. It's unknown, we're still learning about it, and of course unexpected, and so we are still in constant crisis management as things change and as things evolve through it. The next slide please. So in March 2020 the Prime Minister announced that all schools in the UK would close, with the exception of those children who were vulnerable, and that means those who were particularly at risk, according to the Children Act, particularly vulnerable, and also to remain open to children of key workers in order to keep the economy going, the hospitals open, etc., etc. Well, schools, we know schools were central for children's education and well-being and for enabling parents to go to work. So this was a huge, huge decision, one that, as you know, since wartime has not been taken in England. And the implications were huge. And this decision, you know, is impacting on the United Nations Sustainable Development Goals in terms of providing quality education and reducing inequalities, which is going to have a huge impact later on as we start managing this. Next slide, please. So the initial actions in terms of this crisis management were emergency measures to be put into place, all the social distancing, all the regimes of cleaning and alternative curriculum, timetable changes. And these were for the few children who were still attending school. And it was a huge, huge strain on all of the local authorities and schools and the governors who have to implement these actions in order to keep people safe. Next slide, please. So then it was decided that before children could return more fully, 5 key tests had to be passed. And as they're outlined here, we had to make sure the NHS could cope, because the danger was that the COVID-19 were causing people to be admitted to hospital, and the NHS just wasn't in danger of not coping. There had to be a sustained and consistent fall in the daily death rate, which I shall come back to with data. There'll be the rate of infection had to be decreasing to a manageable level, and in England, you know, there was 6,000 at its peak, and ensure that all the personal protective equipment was there to meet the demand, and be confident that any of these measures wouldn't actually create a second peak. Now, we know some of the issues that have happened behind the distribution of the personal protective equipment, etc., etc. But these were the tests that the government said were there before more children could return to school. The head teachers were above all concerned about the health and well-being of the children. And so the aim was that the various age ranges of children would return to school on June the 1st. This couldn't be achieved because the heads wanted to have more sort of staggered and cautious approach to make sure all of the procedures were in place. However, the rationale behind this thinking was really the year 6 children, who are the 10 and 11 years, were about to transfer to secondary school, and the younger children were in theory the children of parents who were actively working. However, if those children had siblings, it didn't help get the parents back, because obviously they had to be at home for the children who didn't fall within that age range. And next slide, please. So further adjustments had to again be made in the schools, all in a crisis management scenario. I was called to various governors' meetings, various Zoom calls, checking constantly risk assessments, because first and foremost, the safety was at stake. And the parents, I mean, what was quite interesting is it was the gaining the confidence from the parents, because by the 11th of June, a lot of children were still not returning to school because there wasn't the confidence in the safety. So even though more online teaching was happening, more changes were happening. It also is to remember that in England, we have a long summer holiday in July through to August. So that was also on the horizon, and parents were also perhaps thinking, well, I don't want to send the children back and then stop them again. However, older children again were to return on the 15th of June, because these children were to be being prepared to go on to their next stage in education and had really missed out with exams. Next stage, please. So the next couple of slides they can go through quickly are pictures of the kinds of ways that schools were adapting to get children to behave differently, and changing that behavior of children was quite hard. Changing the behavior of adults is hard. Changing the behavior of the children was especially hard. So July the 2nd, the government announced that all children would return to school. Key things had to happen in terms of leadership and in terms of support, adapting to the crisis management. And again, it was this area of trust and building the kind of arrangements that would work if a child or an adult had COVID-19. So all the curriculum was rearranged, all the times, the staggering, all kinds of processes were put in place, but with rather vague instructions. So we had instructions like clean hands more often than usual, clean surfaces frequently. They're all subjective comments, and especially the comments about face masks were vague and confusing for schools, and still, I think, they change daily. That instruction changes daily. And next slide, please. So the illustration of the face masks, really, yes, they were, first of all, they were at the discretion of schools. Then it became compulsory for areas in lockdowns, outside all of the, in all of the communal areas. And now they are not compulsory, but it is advised that face masks are worn, and it is the discretion and the judgments at school level about what is appropriate. It's the same message about what happens when a child is, next slide please, when a child is tested positive with COVID-19. There will be track and trace, so they will be tested and traced. If they are proved positive of having COVID-19, the children in that bubble will be sent home along with that teacher. However, in some authorities, they're saying, no, if 2 children in that bubble test positive, then we'll send all of the children home. So there's still variance, even when somebody's tested positively with COVID-19. So additional money has been announced by the government to help pupils catch up. A national tutoring program being put in place. However, what is quite depressing is that the research has shown again that only 1/3 of children have engaged with the work set in terms of online delivery. thereby further widening this digital divide. And there are several reasons for that. One is because some homes just simply have not got computers, access to phones, access to support to do the homework. Some homes are doing alternative things and, quite frankly, are disengaging with the process. And some are trying to do it, but the children are not feeling very engaged in that process after a period of time, because it's not what they're used to. So in terms of what will happen next, we will have more homeschooling, I suspect, as more work is set for particularly older children. We already know that inspections have been postponed. Inspections were due in the schools that I work in and am a governor of, and they have been postponed for a year. Exams, the whole of the exam system is in question, and I think will be dramatically changed. And we've just had a lot of issues with the government with a U-turn on what was going to happen with the exam results and throwing universities into some chaos, which I know Professor Mike Sachs will elaborate on. The real focus has to be on the well-being of young children, because without their well-being, the academic processes are kind of secondary. And we need to, of course, support those most in need. And finally, the key messages on the next slide, because we know that the education will never, I don't think, be the same again, certainly in the foreseeable future until we have vaccines. And it goes against everything we understand about how we teach young children and how young children learn. We're now having to separate children, discourage communication, discourage close working, particularly for those in the early years. It's not something they can understand, and they're having to be trained to stay away. It's kind of not what would come naturally. But the lessons really learned from this particular COVID-19 within the public sector, within schools, is that the clarity of the message is essential, because the minute there is a vagueness or a loophole in the language, the message is misinterpreted and not really followed through in the way that it may have been intended. The credibility of the message is essential, because we've had a lot of science-based focus, obviously necessary. Obviously, it's new to government, and as Alex said, government are in crisis management scenarios. But the credibility of the message has to be round, so that the science is there along with all the other leadership that's necessary to get those messages across. There needs to be a consistency of approach. So if one area is doing something, another area must do something, so that there is consistency and effective analysis then given. Otherwise, that's very difficult to do. And the communication constantly and ongoing through a crisis, because with the parents, the stakeholders in this case, key to getting the children back to school, without them having trust and without them being communicated with and engaged about what's happening and why their children should return, the children then won't return. So those messages have absolutely come out of all the work I've been dealing with in this particular crisis, and for debate and discussion. So thank you.
Indeed. Thank you, Julie. An excellent job as always, and the lessons learned are very unique. We will use this example of what happens with the masks and how the educational sector in the UK is being challenged when we get to the practical part. But yes, thank you for setting the tone as well. This is not just an academic or theoretical discussion. This we have seen in many realms, not only in education, has real issues, and there are people that are suffering in real terms. This is an example. Thank you, Julie, again. And now it's my great honor to open the floor to Professor Mike Sachs, Emeritus Professor of the University of Suffolk in the UK, a Senior Advisor on Leadership to UNITAR, and the Co-Chairman of the Institute for Responsible Leadership. Professor Sachs, you have the floor.
Yes, thank you. Thank you very much, Alex. If we could have the next slide, please, that would be good. This is just to really announce that what I want to do is to talk about learning from failure. which is also an important part of crisis management, actually. One that isn't always spoken about, but one which is very significant. But I want to do this by focusing on UK higher education and health policy. It will mainly be about higher education, but I do want to speak about health policy as well, because it is so significant in terms of dealing with the coronavirus pandemic. So if you could just move me on to the next slide, please, that would be really helpful. Thanks, Julia. And I just wanted to say something about my experience and how it's relevant to the themes I want to talk about. In higher education, I think I hold the world record for being a member of an executive board of 6 UK universities, which is quite a lot. They're all different types, big, large, research intensive, non-research intensive. And also I've been a head honcho as provost, CEO of one of these universities, as well as being deputy vice chancellor and pro vice chancellor. And in addition, as you've seen, I hold an emeritus and visiting chairs at 5 international universities. So I feel relatively well qualified to speak about higher education. And from the viewpoint of health, I have been in my time a Dean of Faculty of Health and Community Studies, in addition to many other roles. And I've also chaired many National Health Service and other committees across the board, including 3 major health charities. And I have, of course, been health advisor to many different international governments, from Cuba to Canada, and also to a wide range of health professions in the UK and internationally as well. So this is my street cred, as it were, as you might say. And with that, Julia, on to the next slide, please. And so the first area is going to be talking about crisis management in the context of coronavirus and higher education. And so if we could just slip on to the next slide, that would be great. Thanks, Julia. And I want to say that this is a particularly sensitive time in higher education, because anyone who reads the UK press, and I'm speaking really primarily about England, I should say here, because there are differences between Scotland, Northern Ireland and Wales in education, as we shall see in health policy as well. But I just want to say that the press has really been pumping up the notion that with university students returning for the next academic year, in the next few days, there are really many challenges posed to UK universities. And primarily the headline has been a threat of a spike in cases as a result of restarting. And the kind of predominantly younger students, 18 to 21, being one of the most vulnerable groups in terms of actually contracting coronavirus. There were statistics in the Times today that showed that they were by far the largest group to have coronavirus, to be tested positive. So there is this threat of a spike in cases as a result of restarting. But these aren't the only challenges. There's been great fear in the university sector about our universities going to recruit to their targets, because this could be pretty disastrous. And it isn't helpful to have Brexit occurring literally in the end of December, because this does seem to have led to a downturn in applications from European Union students more widely. And so this isn't really very helpful. So universities are sort of on tenterhooks about who's going to come. There is also a fear of a loss of international students. This very much affects the Russell Group universities, the elite universities, who heavily stock their incoming student cohorts with international students because they pay more than home students, and this obviously adds to their income. And there was a point where it was being projected that there might be as much as a 60% downturn in the numbers of international students because of COVID-19. But it doesn't, in terms of applications, it doesn't seem that the threat is quite as great as this at all. But nonetheless, there is this fear of who is going to turn up at the door at the universities at the start of play and who is going to stay because of the COVID-19 crisis. And also, and I'm finding this very much as the person who is on the board of a sort of an erstwhile university in London, that there is a very huge cost in implementing safety measures. Julie has been talking about safety measures in schools, and it shouldn't be assumed that this is cost neutral, because, you know, in terms of universities, those students who are coming back physically are often being divided into smaller groups for lectures and for other measures because basically of the risk of COVID-19. And also additional staff are having to be employed to take into account of this, as well as accommodation needs being looked at very carefully. And, you know, do you need to hire extra lecture rooms, extra accommodation that can be used for university delivery purposes? So the challenge in terms of crisis management for universities has been very great, and these are just some of the issues with which they're having to deal. Next slide, please. So in terms of looking at this, the UK government has provided some bounding rules for higher education, which actually, you know, are helpful, you know, in terms of, as Julie is saying, in primary schools, hand washing will be encouraged in the university sector, social distancing will be encouraged by government guidelines, creating safe workplaces is essential, and indeed, where possible and appropriate, home working is encouraged, notwithstanding universities coming back. And indeed, many universities are sort of aiming at blended learning, you know, whereby some of the learning takes place online, some of it takes place in situ in university premises. And the Office for Students, Department for Education have actually brought in other specific measures for higher education. The first cluster are actually generic measures, but they've also brought in some supportive measures, specific supportive measures for universities. They are actually now paying for extra teaching requirements in high cost subject areas. These will particularly be in the science areas, the medicine areas, and so on. And they're also bringing forward tuition fee payments to aid liquidity. So normally, tuition fees will be paid by the government in 3 tranches, and now they're introducing them in 2 tranches, so the money comes more up front in terms of the liquidity issue. And thirdly, the government has also delayed the Research Excellence Framework introduction. The Research Excellence Framework, for those who are not familiar with it, is basically the national audit of research, which leads to mega payments to universities which are research intensive. And the submissions have been delayed by government to enable the focus to be more on supporting teaching in the COVID-19 crisis. And initially, right up until the last moment of recruitment of students to universities, there was a student number cap, because there was a fear that because of the challenges with student recruitment, and particularly of international student recruitment, that some of the more elite universities would try and, if you like, snaffle other students from less well-known, less reputable universities, because they wanted to replace, if you like, the people who would not be there from the global community. And so the government imposed a number cap on how many students could actually be recruited in any particular university to try and remove that threat. However, for reasons which I'll explain in just a moment, this student number cap was removed at the last moment. Julie has referred to this in relation to A-levels, but this has caused absolute havoc, to be honest. So in terms of government crisis management, to be critical, the flaws of this are that insufficient financial support has been provided for universities to offset the costs of new teaching formats in the era of COVID-19. And this includes both extra staffing and infrastructural change. And I know from the particular university that I'm associated with on the board that these can run into millions of pounds. You know, they're not small sums. And this last-minute U-turn on student A-level results, which has led to the issues with the cap, has actually been very, very difficult. What happened was that the universities actually had an algorithm that they introduced in the absence of exams, because the A-level exams were not possible to be conducted. And so therefore, the results from the A-levels had to be socially constructed from what evidence there was available. And the algorithm that was introduced by government initially was highly discriminatory, because students who were coming from disadvantaged backgrounds had their grades taken down because in the past they hadn't had such good results. And this obviously wasn't good for inequality. And what happened was, because there was such an outcry at this algorithm, which led to a reduction in the level of results that people achieved as against previous years, it was decided to go with teacher predictions in lieu of examinations. And these teacher predictions, this was decided very much at the last minute of recruitment, at the recruitment stage. And these teacher predictions actually gave a much higher results profile than those in the algorithm. And to just tell you this, that with the teacher predictions, there were almost 50% higher grades at A and A star as previously under the algorithm. And so what this meant was that the students were very much favored, which wasn't a bad thing in this crisis. But as a result, at the last minute, an excess tranche of students were coming through because more of them were meeting the grades they were asked for. And so I know from managing universities that you make judgments about the likely number of students coming through who are going to meet their grades in terms of assessing how many you can take. And so what it meant was that many universities couldn't give places to students because they just didn't have them. They just didn't have them because the pool of students was inflated as a result of the changing basis on which students were accepted in terms of their A-level grades. And this has had a hugely devastating effect because many students have had to defer taking a place to the next year rather than having their places immediately this year because there simply wasn't the capacity. And there are still potential legal situations arising from this, which is even more disturbing. There are some exceptions to this, so that in medicine and some other areas, there has been some relief from government, in terms of allowing more students to come through, as I've said, in terms of subsidizing more teaching capacity in selected areas. But basically, it has caused huge headaches for universities in terms of crisis management, in terms of what they do to try and accommodate the students with all the distress that a deferral for a year might cause. And the fourth point I really wanted to make is that there's been too much devolution of decision making to universities and too little central direction. And so, as Julie was saying in relation to primary schools and other schools, it's up to universities to decide whether they have blended learning, whether they go down the course that Cambridge University has taken, which is basically to say that all their teaching will be online up until 2021. And that's been left to the discretion of universities rather than any kind of template that the government has been seeking to impose, rightly or wrongly. So next slide, please. So I now want to just say one or two words about coronavirus and health policy. Not a lot, because I want to say that, that basically the issues that arise in relation to the higher education policy are also mirrored to some degree in the health policy the government has adopted. Next slide, please. So in my penultimate slide, I just really want to say that we do see similar difficulties in relation to health crisis management in response to the pandemic in terms of government actions. I mean, we have in the UK about 1/3 cases and around 41,000 deaths, which is large enough. And we have had a spike just this weekend. On one of the days, there were 3,000 new cases. And this is only half, it's half the amount they were at the absolute peak of the coronavirus issue. So there are some real health crisis management issues which are right up front. And I think the government has really made some errors in terms of moving forward. There was a very late response to the initial spate of coronavirus as compared with the rest of Europe. The government didn't set good examples, because when the most senior government advisor completely breached the lockdown in coronavirus, he was enabled still to keep his job, which was quite amazing, I think, for many people in the UK. And there has been a delayed and inadequate testing and tracing procedure. We still have a position where just last week it was noted that some people had to travel 100 to 150 miles to go to a testing center. I mean, at this stage of the crisis, that really is unacceptable. And indeed, for 2 or 3 months, when the crisis was at its highest, there was insufficient personal protective equipment, and this included in hospitals and intensive care units. It included particularly in care homes, where there was a very cavalier approach that was adopted to the requirements. There's been a very slow response and a poor response to international travel restrictions. So for several weeks, for many weeks, there were no travel restrictions, and people just came into the country without any requirement for quarantine or anything like this, or testing or anything. This has now changed and it's become much tighter, but it was a very delayed response. And there has been confusing advice. Julie has mentioned the confusing advice in primary schools about face masks. But this has been more generally the case. So, if you're going to a supermarket or a shop for many, many weeks, it has been really unclear about whether you should wear a face mask or not, whether those people serving in the shop should wear face masks, how it should be enforced. Should it be the responsibility of the shop to reinforce it? Should they just stand back? And there's been very many different policies by different retail outlets. So this has really been very difficult. And organizations, when the government was trying to encourage them to go back to work, to employees to go back if they needed to go back to their workplace, I remember this classic case that they actually gave advice on Sunday evening and said, yes, they wanted people to go back to their workplace. And they just hadn't even thought out what kind of guidelines they will give employers. And so they told employers to go back on Monday, but they didn't give the organization sufficient time to implement any guidelines. And they were very slow in coming up with guidelines. And that caused immense difficulties, immense confusion. And although we have to say that, we're all wrestling with a difficult situation, I think this has made it very difficult indeed, almost impossible for healthcare and employing bodies and the public to respond as it might have done to the COVID-19 pandemic, and almost certainly has led to an escalation in the number of cases and deaths and so on. And so we need to bear that in mind. So if I could just go to the final slide, please. Julia, thank you. So I just want to say that really, in a sense, I can say that in higher education and in health policy, there have arguably been failures. But even with the mitigation of this being absolutely out of the box, left field, incredibly dramatic, as Alex has said, in terms of moving forward, that much higher education and health policy in face of COVID-19 can be seen as a failure of responsible leadership. I mean, there have been good things that have been done, but I think that with a wider vision and with a greater sensitivity to stakeholders, we could have had a better outcome, and we could have had better leadership. But it's very important in all this, as with crisis management generally, that we positively, honestly and transparently learn from failures. We don't bury them, but we try and do better next time. We try and do better next week, next month, next year, perhaps, with COVID-19 as we go forward. And we don't try and cover them up with fine words. And there's been a lot of this in the UK, because we've heard from Julie that the government talks about, well, this is all underlined by science. Policy and politics is not the same as underlined by science, because scientists themselves don't disagree. They don't always agree. And this has been particularly true about COVID-19. And I think the science issue is good that we've got an evidence base, but it doesn't include social science. It doesn't include very much, as Alex was saying earlier on, well, how do we deal with mental health? It's not just physical health, we need to look at both. And I think that governments have been a bit disingenuous. And when we look at the daily briefings that used to occur with COVID-19, we find that the figures are being manipulated. So at first, we only have figures of deaths from hospitals, not in care homes, for example. And at first, we had the international picture, but as soon as the UK went up to being second in line in terms of the deaths from COVID-19, suddenly the international statistics were not presented in order to contextualize the UK position. And this is very important in terms of my final couple of points, which is we do need to learn from the international context. And I think that although I know there are now a couple of deaths in New Zealand, over 100 cases, that New Zealand responded to COVID-19 in a very intelligent way, I think, in terms of leadership, because they cut down on, migration, into the country without proper testing. And so they tended to sort of try and isolate themselves a little bit from the outer world in order to control COVID-19 within the country itself, at least as a pro tem response. And I certainly hope that going forward, we can act more responsibly in line with the UN Sustainable Development Goals in all their manifestations. And we can learn far more from the international community in terms of what responsible leadership might be and what irresponsible leadership, as in some other countries, might actually be as well, so that we can actually chart a course through this very difficult crisis management situation and come out with a far more positive conclusion to what is a horrendously difficult situation to deal with. Thank you.
Thank you, Professor Sachs. Always very interested to hear you from the lessons that you capture using your vast experience. In the particular case of the educational system in the United Kingdom, this complements very well what Julie has shared as an analysis earlier. I think we have a very detailed view of how crisis management has been performed in the UK. As we all know, at the United Nations and at UNITAD, we don't issue any judgment. We are not saying this is good or bad. We simply want to analyze what is happening and hopefully use this or leverage this information so people can learn about it or can go deeper so we can capture some lessons. So thank you, Professor Sachs, for that very good presentation. Now it is my great honor to invite our next panelist, Professor Miwako Hosoda, Vice President of Seisei University in Japan. I welcome you, Professor Hosoda. The floor is yours.
Thank you very much for your introduction, Alex.
Pleasure.
So, thank you. So my name is Miwako Hosoda. It is really great honor for me to talk this theme on this webinar. So today, I'd like to talk on the theme, developing public trust in managing COVID-19. So I learned a lot from this, and I'd like to share the Japanese situation, and also I'd like to share the lessons from we have learned. So currently, there are 70,000 corona cases in Japan, including 1,300 deaths. So far, the number of infected people in Tokyo, the capital, is 18,000. Infected people are often found in urban areas. And currently, there are about 200 infected people every day. Next slide, please. The first corona positive case in Japan was confirmed on January 6, 2020. The man was the flu returned from Wuhan, China. Due to mass infection on the cruise ship Diamond Princess, which arrived at Yokohama port on February 3rd, the Japanese people suddenly began to pay attention to this unknown infectious disease. The government took measures against the infectious disease on Diamond Princess, but due to the various restrictions, people were told that it was not working well by social media and mass media. And next slide, please. There are rumors that surgical, the face masks, and toilet paper ran out. I'm sorry, the one slide before. Could you? Yes, thank you. I'm so sorry. I mistakenly told the next slide. Sorry. And there was a rumor that face masks and toilet paper ran out on social media, and people went to buy masks and toilet paper like a panic, and they sold out one after another, and it is called infodemic. So next slide, please. And on April 16, the government issued the state emergency declaration. This was so this is close to the lockdown on the city, but there are no penalties, so people are able to go out in such case for the exercise or buying the daily food. So the government asked citizens to keep social distancing and refrain not going out. The schools are already closed from March 4th before that, and some schools offered online classes. People disappeared from the town. Maybe you can see the Shibuya crossing in the previous slide. Before, the people were walking on the crossroad, yeah. But under the state emergency declaration, that there are quite a few people on the street. So next slide, please. The self-restraint of the state emergency declaration has also caused many negative results. The lot of employed people came out because of economic activities declined. And as Julia told before, the same things has happened in Japan. The educational gap were widened. Some students were able to receive online education while other students cannot afford to eat because they don't have any personal computer at home and they do not have good Wi-Fi environment. And discrimination against infected person has occurred. And not only infected person, but also medical staffs and the hotel employees who accept mildly infected persons were also subject to stigma and discrimination. Next slide, please. And what has behind the people's panicking at COVID-19? Buying panic, discriminating against infected people, and becoming suspicious to others. Actually, the government gathered infectious disease experts and established an expert council under the government. Originally, it was in the position of giving advice to the government. However, you can stay here. However, the relationship between the expert council and the government was not clear to the people. So there are poor communication between the expert council and the government too. So since the government did not send out official clear message to the people, the expert council promptly announced the danger of COVID-19 and advised how to prevent infection to the media. This has led the people to think that the statement of the expert council were as if they are representing the government. However, the member of the expert council was an infectious disease expert, but did not understand the economic situation. So the council did not include experts in social policy, economics, industry, education, and psychology. People's lives are made up of various factors, not only COVID-19, obviously. It is necessary to look from the more compound viewpoint. However, this time in Japan, it was failed, and the people feel excessive fear and became distrust. Next slide, please. So there are some challenges of expert, media, and government we can learn from our previous experience. So how to tell the expert perspective without causing anxiety? Maybe more analysis and commentary from the medical journalist is necessary. And how to communicate when the government's direction is uncertain. Probably more engagement between different stakeholders like politics, science, economics, and citizens. Deep conversation and dialogue are necessary. And how to release information on the infected persons or infection route, and how to protect the people's privacy. We should discuss this more widely. Next slide, please. And also, there is something the civil society can do. So what should be able to withstand uncertainty? So medicine has both sides of science and art. And sometimes the view of experts can be uncertain. It is also necessary to endure uncertainty for people and publics. So can we withstand the medical uncertainties? The answer could be we try to do so by referring the expert and also obtain health literacy and media literacy. So as the previous presenter told, risk communication is really important, and also we have to think what is the risk and how much risk we can be affordable. So there are a lot of challenge when we face COVID-19. So I would like to share the lesson and to improve the situation in the future. Thank you very much.
Thank you so much, Miwako. It's been a very revealing, just two comments, a very revealing presentation. The case of Japan is quite unique, and we have to remember Tokyo is a city with more than 20 million inhabitants. I had the privilege of living and working in Japan for 3 years, and I have always admired the role of the national government of Japan, and particularly the municipal government of Tokyo, because to manage such a humongous urban area is not easy. But correctly said, you know, we have to learn. Sometimes the responsibility lies in the individual, and that's what I want to do. In your presentation, you correctly call our attention to what we have to do in light of the information. At the end of the day, it is the individual that makes the final decision. And also, as Professor Hosoda said, I think we can understand that in this particular crisis, a health crisis, medicine is not absolute. This is a very important message that she has given us. And medicine is indeed a science, but it's also part of an art. And my respect to all the medical professionals, they have shown the world that we can depend on them, but still, this is a science that is progressing. It's not definite, and there are things still to learn. The best example is all these trials to try to find a vaccine for the coronavirus. COVID-19 is still raging and breaking havoc because there is certain part of the medical science that is still challenging. So thank you, Professor Hosoda, for that. And now it is my great privilege to invite a great friend of UNITAR and someone that I know very well, Dr. Shep True. Dr. True is the graduate dean for the College Graduate and Professional Education at Kansas State University. He's an associate vice provost for global affairs at the University KSU and professor of marketing at the College of Business. Dr. True, the floor is yours. Thank you.
Thank you very much, Alex, and thank you everybody for allowing me to be here today. It's indeed an honor, especially during this time of crisis. You know, I'm a big believer in the power of three, that usually with three things you can cover everything. And so going forth today, I kind of took the bet to myself that everything would be covered that needed to be said, and it was. So with that being said, I think I'll just do a little summary of picking, you know, what my experience has been. I mean, my colleagues on the panel today, I think, are a lot more attuned and more experts in terms of the policy and the medical part that they've done. You know, that's not really been my role. I'm a business professor. I'm a marketing guy. You know, and I guess some of my faculty colleagues would say I'm more of an administrator now for 10 years. So, you know, I'm going to really just kind of give you my experience and what I've seen through this crisis. So I'm not here to represent what happened in Kennesaw, but it's really what I've seen at my university. My sons go to different universities. I've got friends and family across the U.S. And colleagues we talk to. And, you know, one thing I think is good is that what I've heard today is what they're doing in the UK. It's similar to what is happening here in the U.S. You know, I've been a little bit afraid when this crisis first came out. My first involvement was back in February when it first kind of broke. And I was in charge of all the study abroad. And we had students across the world, you know, and we focused on trying to get them home, as well as help our international students with our university get back to their homes, or deal with changes in visa rules that the U.S. government was putting out. And then it quickly turned to, you know, isolation, quarantine, shutting things down, and what did that mean for our university? You know, look, I'm a big advocate of higher education, but sometimes I'm a skeptic, a little pessimistic about our ability to react fast. I know in a few years from now, we're going to do a great job of looking back and saying, these were good decisions, these were bad decisions, and these were leaders could have been better. But quite frankly, I've been very impressed as a whole of how academia has responded to this. You know, in no way is perfect, And in fact, it's quite difficult, I think, to decide what is success right now, except for looking at deaths, of course. And, but it's hard to point the finger on which death can be blamed on which action. So I start off with what Mike Sachs talked about, learning from failure. And yeah, this is a great slide, I think, to hold on for us. I think that we've done a really good job overall as academia in terms of learning from our failures on a daily basis. And the key is that there's so many alternatives that, of course, COVID is unprecedented, at least in our lifetimes, I guess, and how it's affected an industry. Because, it's weighing, it's balancing those stakeholders. Of course, the safety of our students, our faculty, our staff, and society is important, but as I think Julie mentioned earlier on, the impact was huge, about the well-being of students. And it's about the well-being of our employees. It's about well-being of society. And it's not just health. Of course, that's the predominant thing, but it's economic well-being. I'm at what I consider to be a very high-level school. We're large, with 40,000 students. Perhaps we wouldn't be called an A-level school, but we're getting there. And we do well, but those economic impacts, it's a huge thing, but how you balance. Some of our A-level schools that have, $1 billion endowments, $100 million endowments, they can make decisions a little bit easier. Say, we're going to go online just right quick, which sounds like the easy decision, but yet that results in us having a shortfall of millions and millions of dollars that results in people losing their jobs. And, it's how do you balance that? And that's really been, I think, a great lesson for academia to go through because it is uncertain. I think here's Mikado Asada mentioned enduring uncertainty. And that's what it is every day for us to figure out, which charts do you follow in terms of what matters, new cases, hospital deaths, ongoing, and so forth. And so I think we've done a really great job of figuring those things out because the consequences are high. And, I think in the end, the basics always come back. I mean, I'm the kind of professor who say, let's look at the fundamentals, particularly in decision-making and leadership. And I saw that Mikado had a slide there at the end that kind of popped up. I've got one that I'll pop up. It's all the words that go with, decision-making and crisis communication. I think, Julie kind of stole my thunder because my wife's name is Cynthia. So everything I do, I try to put around in the word C, so I can remember it. And, she said, communicating the message, we've got to make sure it's clear, it's credible, it's consistent to our stakeholders. But, what I've seen is that the best decisions that have been made or the decisions that we've reacted to, we've changed based on failure. We learn based on failure. We're also a result of collaborating and coordinating faculty, staff, and students. This is what we've done from my conversations and readings across the country. It's what pretty much everybody's done. We had a presidential task force that started back in April, from enrollment to safety to finances, looking at every issue we could, every impact we could. And so it involved alumni, external stakeholders, as well as faculty, administrators, and staff, and constant communicating. I mean, in the US, I think it's the same in the UK. Most faculty are on 9-month contracts, so they're not paid to work in the summer because they do their own research or they do their own thing. I've been really impressed that our faculty had just met 2 or 3 times a week all summer. Online, of course, social distancing, but it just how are we, figuring out how can we best deliver our product in a safe way to keep economically viable? How can we make sure that people are educated from virtual study abroads to online courses to hybrid courses? I think you called them blending, to making sure how do we get students to show up at the right time at the right place, from the little things, from our president out there measuring how far classes work, desks are apart, and the extra expense. I know that Mike mentioned earlier on the cost that comes along with this. We've spent just an inordinate amount of money trying to make sure that we train our faculty to do a better job than we did in March and April of going online. From what I've seen this August and September, our faculty are a lot more prepared to go online. who've never done it before. Usually I'm always wanting to go back and be a faculty member because I say, you know, this is a hard job I have as administrator, so I'm glad I'm not teaching. This is the first semester I thought, you know what, I'm glad I'm not teaching because it just is a whole lot of work, I think, of having to do it. But, you know, I think the lessons we've got here is that, you know, one of the things about leadership to me, it's always about influence. But, you know, really when it comes down to, I think here, it's about communication and commitment. And this crisis that we've been in, there is no certain path right now, and it's enduring this uncertainty. I think a lot of mistakes have been made, but in higher education, as you mentioned, we're dealing with adults. Even if they're 18 years old, they're adults. We're dealing with their parents. We're dealing with the people who have their different types of opinions. You know, it's just the whole influx of information, I think, has really made this a great laboratory experiment that we're going to learn from. Hopefully, we're doing it on the fly fairly well of making these commitments. But the key has been what I've seen, it's just the big of communication, being open and honest and transparent. With that, I just want to keep going on. It's just, I think the last thing I finish with is reimagining business as usual. I think that was said earlier. If anything good can come out of this, maybe this is a chance where we make a transition of how higher education can be delivered more effectively to a more mobile, a more global, diverse audience that's more interconnected than it's ever been. And we can figure out how to do that more efficiently and effectively. In the meantime, I'm hopeful that with conferences like this, and I know that all the interactions at the Institute of Responsible Management, Prime, that I'm ACSB, things I'm dealt with in the business area, around the world with people interacting, there's enough best practices going around to help us get through this. So with that, I know that we're running a little short on time. I'd like to open up for Q&A, but thank you very much.
Thank you very much, Dr. True. A very revealing approach, and especially thank you for those impressive graphics that you have. But I have a couple of comments on what you have suggested, and this is a different paradigm. But I know we are running out of time, and in the 8 minutes that we have, I wanted, if I may, to jump directly into the Q&A. We have several questions. I'm going to read one, and any of you, of course, distinguished panelists, can please give us some comments. Mr. Onkar Puri, advisor for disaster management at the government of India, is postulating the following: Will economic development can economic development be enhanced in the post-COVID era with employment generation and poverty eradication? So he's asking us, and all of you as expert academicians, that people understand, that understand crisis management, if the post-COVID will see a different kind of economic development, and particularly of employment generation and poverty eradication. Any comments from any of you?
I'll give it a shot to start out. I think if I understood the question correctly, and I think, you know, it's this can have a positive effect in the long term of economic development across the world, because, you know, now we're seeing how universities can reach audiences that didn't necessarily have access and choice. You know, as a business professor and marketing, I'm big on choice. And, you know, in the past, you only had choices of where you are. We're going to have a lot more resources to reach out to around the world. If we believe in the value of higher education, we think that higher education leads to more economic development because it leads to more progress and better decisions in the world. And if more universities around the world can have a farther reach, it's got to have a positive impact. I'm a big believer in competition, you know, and so obviously now, you know, it's students around the world, populations can get the best. And, you know, basic economics shows supply and demand, that price is going to go down the more we have people supplying better education. So I think it can.
Indeed, and I couldn't but agree. And this leads me, before I pass to the next comment, sorry to bother you again, Dr. True, but your words inspired me for this. The role of youth, the role of young people, helped by the faculty in ways that you mentioned, your university really has an impressive growth. and an impressive student body. I don't know how many, but I believe more than 20,000 or a lot more than that. Dr. Bimpin told me, but I have fragile memory. But it's an impressive, impressively big potential that you have because of how big your student population is. Can you tell us, Dr. True, just remind me first the number of students you have, but also what has, let's go to the other side when it comes to the educational sector. What can you tell us about the reaction of young people? How did they react to this new modus operandi? Back to you.
Yeah, so yeah, we just hit 41,000, you know, and it's a big fear across, I think, at least in Georgia. Everybody's worried about enrollment, of course, because we need tuition in our model. We're up 15% enrollment. Most universities, I think, have seen a growth in the U.S. And I think it's because people just need to be able to do something during this time. Of course, we've lost a lot in terms of our international students, which has been difficult, and we try to make those adjustments to get them to go online. I think, as Mike mentioned, in the UK, people are deferring. We're seeing that as well. Those audience will have to adapt if COVID continues, if the restrictions on visas and travel, as well as just an attitude towards school in the U.S. continues. That's something we've got to battle. Yeah, it's like anywhere. We've had people very positive to embracing the change, and those not embracing the change. We've got a whole huge new segment that want to continue online, want more online. They've seen the convenience factor, right? But then we've also got those who want to come back in person and have that experience. Again, I think this is good that the world's getting younger, particularly in the U.S., where we're becoming a younger demographic. It's going to push us old professors to change, because academia is an old institution that didn't want to change, but there's power in numbers. And I think it's forcing all of us to embrace technology. And, you know, while I believe in competition, I think it's good. I also believe in the collaborative nature of academia. And while we compete more and more for students, because it's our livelihood, the collaboration I see, I was on calls this last week with some of our partners in Europe, you know, and designing virtual experiences of how we can get experts to communicate to our students more often. I did that a little bit in the past because, heck, I wanted to go to Spain. I wanted to go to Africa. I wanted to take that trip, you know, but now that it's not possible, if I really care about my students in the education, I think they're embracing this push of how do I make technology? And quite frankly, in some ways it's a little bit better. And so it's going to get there. Everybody's going to take change, difficult, but if we work together, we can do it.
Indeed, indeed. And while you were speaking, we received one new comment. If you can read, the panelists can see that comment. Ms. Emily, you wrote, how can we transform this crisis into new opportunities through crisis management? Crisis management really makes a difference. Leadership makes a difference. And I wanted to ask Professor Hosoda from the case of Japan, and particularly of Tokyo, that you very well explained to us. The same question that I asked to Dr. True. How, at Seisa University, how have you seen the reaction of the young people? Do they understand the need to manage the crisis? What comments can you give us from your student population?
Thank you very much for your question. Yeah, actually, in the university in Japan, even though the positive case are low, the most of the university are supposed to close the end of this year, because, you know, in the early stage, the one university has several positive case, and mass media attacks that university, and every university in Japan are afraid of having the student be infected. So my university is you provide only online course university, just before the corona pandemic. So we keep using remote learning with the student. So it was our actually our unique teaching method. However, now almost all Japanese universities start online course. So the educational the method totally changed afterward with Corona era.
Yeah. Indeed, it's a new scenario, and you describe it well. Most universities have changed, but at the beginning, not everyone was prepared. So congratulations to Cesar University, because you were already prepared, and it has made a big difference indeed. Now, let me go to Dr. Seshri Thakur. Julie, there was a comment from one of the participants, and we have a very good number of participants from very many countries. I'm quite impressed. Let me refer to that. His comment was on economic and social political measures, but about self-reliance. So let me ask you, the self-reliance of the individual versus just wait until the government, because of crisis management, they know what to do on crisis management, we just follow the instruction of the government. What is the balance between self-reliance and simply obeying the rules of the government? You are muted, by the way. I'm sorry. Muted, yeah.
There you go. Sorry. Yeah, that's a very good question. I think when it comes to the big ticket things, like big decisions to save people's lives, there has to be clear direction from the evidence available. I don't think it's a matter, I think there's too much dissemination of really critical decisions that could have saved lives, could have prevented illness. So the balance is you have to have the tools for people who are managing and making the decisions to make sensible decisions with the information they have. But there has to be really clear guidance. And yes, you can have clear guidance and then interpret from that guidance, which is what effectively the government are saying, oh, well, we've got all this information now, you as individual places can apply that as best suits the needs of the local situation or whatever. But I think just very simply, if it's big decisions, like for example, face masks, and it's evident that if the more face masks are worn, the less the spread of the diseases, however the science evidence is, that should be a clear directive, not confusion about one place could do this. But however self-reliant people are and however much they want to apply their own local intelligence, they do need the guidance for us all in a collaborative way to do the same things. Otherwise, it contradicts the bigger picture.
Indeed.
So I think, yeah, the very big stuff, you need clear direction until another evidence comes back.
Indeed, one of the critical pieces of crisis management is the right communication, as some of you have alluded here.
Yeah.
If you don't receive good communication, even if you are a self-reliant people and a mature people and a person that can think and make sound decisions, it's very difficult. We all understand that, and of course, we wish for the best in what comes ahead. Several people are talking of a second wave of the coronavirus. In some cases, there are numbers to support that. In other cases, we don't know, but whatever happens ahead, the communication remains critical. Now, before we go to the last question to Professor Sachs, I wanted to ask my colleague, Dr. Jiang, Bim, if you can do me a favor, you part of the team, you work with the university, but also represent the United Nations at UNITAR as an associated fellow. After Dr. Sachs, if it would be possible for you to give us some general comments on the Sustainable Development Goals. And why is it important to defend them, to maintain them, to continue the fight against poverty during the crisis? that would be very appreciated, Bimbing. But first, let me, I just wanted to give you a heads up. Let me go to Professor Sachs on another one of the questions or comments postulated in the Q&A that says the following. And this goes, Mike, if I may, to your vast experience dealing with government and public policy. The question is the following. Do governments need to take collective measures for the eradication of the parallel economy, the black market, the money laundering, the tax havens, and so on, in order, of course, to be better after the crisis? It doesn't say, but that's the intention of the question. So can you give us some comments about these issues in the economy? Are they still important during the coronavirus crisis?
Okay, yeah. And I think that, yes, governments do need to take action because, you know, we've heard from Wiwako, for example, that, you know, there can be a run on all sorts of commodities because they're perceived to be in short supply. And I think the government need to, actually, the issues of supply chains are really important, you know, maintaining good supply chains internationally, particularly at a time when there are these shortages and goods are not transferring between countries in the same way as they were before. And of course, in the UK, we have other issues to do with Brexit and potential trade deals and so on, which are really important. So I think that governments do need to have a very firm hand on the tiller, as we would say, in terms of providing direction as to what is possible in terms of, you know, controlling black markets, because obviously black markets are quite rife in some countries, and you know, they're part of the cultural pattern. But certainly they can be seen to be undesirable because in terms of the sustainable development goals, which you also raise, they can actually lead to fairly gross inequalities. So those who are disadvantaged, those who are in poverty, are less able to access those markets than others who are, you know, more well-heeled and richer and so on. And so that really, really is important. I mean, inequality is, combating inequality is absolutely vital, a vital part of the sustainable development goals. But it's just very, very critical that, you know, as much as we may become wrapped up in the coronavirus issue, that we don't lose sight of all the other things which are wrapped around, which include issues of ethnic inequalities, gender inequalities, which includes issues like dealing with climate change. I mean, oddly enough, I mean, one of the perverse issues related to COVID-19 has been that, you know, we've had less planes flying, we've had less pollution in terms of transport and so on. And so, but that is just a transitory issue. And I think what we've got to do is to learn from these kind of spin-offs, serendipitous spin-offs from COVID-19. It may be appalling, but I think as was being said by yourself, Alex, you know, we need to see what are the positives, what are the silver linings, what can we learn? And you know, I think that I just wanted to make one comment actually about how what I've learned most from this in relation to higher education, and I'm sure Sheb has also experienced this, is that I have been so impressed with the creativity and innovation that students have actually shown, and indeed staff. You know, they're dealing with a completely left field issue. And notwithstanding, you know, whatever may be issued from government and so on, they have actually shown massive ingenuity. And I would go back to a UN UNITAR webinar that I was involved in to do with youth leadership just a few weeks ago. And I was so impressed that there were a range of students from 12 to 25 who were saying, you know, what have they been doing during the crisis? And one had been making respiratory equipment, you know, to help out with people who were seriously ill. Another one had set up a website, you know, for monitoring data on deaths and the numbers of cases across the globe, which was a go-to website, you know, with over 100,000 hits a day and so on. And I mean, you know, these were young people, and even the 12-year-old had been developing educational games, you know, to assist people in the midst of COVID-19 with their learning, you know, when they weren't able, you know, to go to Julie, you weren't able to go to school and so on. And I just thought, really, I have fantastic hope for the future. And this is where, you know, where I have a common cause with Sheb, because I just think the young people, they can be somewhat stigmatized. You know, they're spreading COVID-19 more than other people. They're less attentive to the rules because they're less under threat of mortality. But they are our future, and they are, you know, in many ways fantastic. And they really have had some of these features of their persona sharpened by the COVID-19 event. And I think that will be a tremendous strength going forward to the future.
Thank you, Mike. I can only say bravo. Yes, because the future is them. To make a long story short. So before we go to some closing remarks from Dr. Bingbing Jiang, let me just also acknowledge, because we have several comments, 12 new ones that I couldn't read because of time, but there are two that I believe I should read. Someone from Ethiopia says, thank you very much for this webinar. I'm from Ethiopia, from a sector that is very affected by COVID-19, which is the educational sector. However, in my country, to apply online education options is very difficult. Are there other options? And then right before, Ms. Kathy Corcoran writes, how do you see this pandemic and this crisis management changes impacting education in the long term, in the years to come? With discussions and social interaction being a staple of education and teaching, what do you think the long-term impact of virtual learning will be? How virtual learning will be? How learning will be, if I may? And this is the question that really captured my attention. She writes, will we be raising a generation excelling digitally, but very capped socially? And this is correct. Part of what crisis management, virtuous, positive crisis management should be, is exactly that, to think in the long term, not only in the immediate crisis, because this is a more than relevant question. What is going to happen if we continue to have students that don't have the human interaction that we normally have at elementary level, at secondary level, at the higher level? Those are different individuals, for sure. Good or bad, I don't have I'm not issuing judgment, but this comment is very relevant. And then in the end, I have several other comments that, as I say, unfortunately I cannot read, but Ms. Tavo Tinyaye says, just give me 30 seconds. I captured from one of our panelists that this period calls for countries to carry on the reforms to adapt to the new normal. However, African countries face the challenge of lack of resources, and we don't have digital platforms. This has caused a severe challenge on implementation strategies on education since the Great Lockdown. I believe that most countries, that this type of countries will be left behind, very sad, at the end of 2030, but this is correct. If we continue like this, with crisis management that is very advanced, developed, and virtuous in countries that have resources, and poor crisis management in countries that lack resources, the crisis that they had before will be perpetuated. Tavo says, how can crisis management assist in those countries that are still engaged with the old ways of governance and that have zero or almost no access to the internet? Thank you, and I wish to commend all the panelists for a great webinar. This was very fruitful. So thank you, Tavo. Thank you also on behalf of UNITAR. But before we go, allow me to invite Dr. Bingbing Jiang to give us some views as closing remarks pertaining to the SDGs. Bingbing, please.
Thank you, Alex. I want to thank all the panelists for your insightful experiences sharing, and also inspirational comments to all the audiences. I just want to mention CIFO Atlanta is part of the United Nations Institute for Training and Research. And during the pandemic, we have been working with UNITAR and all our stakeholders especially focusing on education, SDG 4, SDG 3, the well-being health, and also partnership, SDG 17. We work with different stakeholders in terms of working with youth and youth leaders to be more creative, innovative, and encouraging and inspiring youth and students in taking advantage of this opportunity to learn about SDGs and to take action in contributing to the society and reducing the damage and the negative impact of the pandemic. And actually, next week, September 16th, we have a webinar titled Student Leaders in the Context of COVID-19, where we are featuring 5 student leaders from Kennesaw State University and Metro Atlanta to actually talk about their leadership experiences during the pandemic. So I, of course, invite all of you, if you have an opportunity, to participate and listen to the student voices and learn from, because they are the future. They are, are going to make the impact for the society across the globe. Thank you very much. I know all of you are very busy. I wish you a wonderful rest of the day. And we are working together to make our world a better place for all of us to continue to survive and live in and prosper.
Indeed. Thank you so much. All the best to all of you. This meeting is adjourned. Bye-bye. Thank you.
Bye.
Bye. Thank you.